All right, I'm going to go ahead and get started. We will probably have more people joining us. Thank you all for taking the time with our statewide partnerships and practice quarterly meeting. We have two different speakers with us today, and we appreciate, as always, our special guests' time and expertise, willingness to share their work. As we go on, please do try to make sure you stay muted during the speakers. Feel free to put any questions into the chat box. We should have time towards the end of their presentations to have conversations, and at that point, if people want to unmute and ask their questions live, you're more than welcome to. Otherwise, do make use of the chat box. We are recording this meeting, and so I will make sure that it is posted afterwards. And as always, if people have questions or ideas, feel free to either reach out to me at the Governor's Prevention Partnership or Gregory Simpson with Beacon Health Options. And with that, we will go ahead and get started. I will at the very end have a couple of announcements to share. So if anybody else you can think about, if there's anything in terms of announcements that you would like to share with this group, you can also let me know at that time. All right, so today joining us from New Milford Police Department is Justin Cullmer, the community care coordinator, and with the Recovery Network of Programs and their partnership with the Stamford Police Department, we have Captain Hohn, Jennifer Kolakowski, and Fram Rodriguez. So with that, I will go to Justin.
Thank you, Deborah. Morning, everyone. I'm going to try to keep it brief because I really want to learn about what's going on in Stamford. It sounds like a little bit more fun than what I'm having up here in New Milford. But today we're really just going to talk about this community policing initiative we started up here in New Milford about a little over a year and a half ago, really designed around just helping vulnerable people. Deborah, you want to hit next? So kind of wanted to just start briefly with, what we're going to talk about today, which is a little bit of background on what the town of New Milford is, the actual initiative and what we implemented, and then some of the results that we're starting to see today. So moving forward, I think this is a very familiar photo to a lot of people, especially in policing. Obviously, on the left, Norman Rockwell's, just really what an officer should be, talking with, someone who needs a little bit of advice and how kind of the public image of policing has changed in the 21st century, which is, obviously upsetting because we want it to be more on the left, not the right. And I think that a lot of us in policing across the state and across the country have been really engaging with people. But specifically in the town of New Milford, you can see coming up on the next slide, sorry, next slide. We roughly have about 27,000 residents. The red location is exactly where New Milford is. It's in lower Litchfield County. It borders upper Fairfield County. So we share a lot of resources with Danbury, Brookfield, and Bethel. Because as you can see, even though we're the largest geographical town in the state, we actually don't have med management prescribers. So those who are unfamiliar with that line of work, we don't have someone who's prescribing Suboxone and Methadone here in New Milford. We actually outsource that a lot to Danbury and the Torrington area. But however, we do have our own internal hospital. So when we started this a couple of years ago now, we saw a growing number of homeless. We saw a growing number of overdoses, mental health related calls, and just vulnerable people in general. So moving forward, I actually was talking with the mayor about a year and a half ago and the police chief, and we kind of came up with this idea of what can we do different in New Milford? And there have been a lot of great programs happening across the country and across the state. However, we wanted to try to adapt it to specifically what we thought New Milford could use best. So we created a unique initiative designed around helping what we wanted to. So on the next slide, we'll talk a little bit about what my responsibilities are. Really respond to any substance use related call, whether that's abuse or overdose, and that could be any sort of substance. That could be abusing pain medications. It could be alcohol, it could be crack cocaine, really what everyone's struggling with, any sort of substance abuse and any specific overdose that we see. Same thing with mental health, any mental health related call and any potential or completed suicide. Anyone struggling with homelessness, and that's kind of adapted to given the COVID pandemic. And then really any domestic violence related call where we think that people could follow up and get resources. So when I respond to these scenes, I'm primarily responsible for assessing the situation and then helping that individual and family navigate appropriate resources to move forward with their lives. So suffering from substance use or substance abuse, I should say, finding what they're eligible for, whether that's detox, whether that's inpatient rehab, whether that's outpatient substance use treatment. And then as you can see on the right, we're not just getting calls for service through the police department, community providers, such as New Milford Social Services or the Senior Center or New Milford Behavioral Health can call, the hospital can call, as well as, family and friend. We do have my cell phone out there, as well as anybody can walk into the police department and ask for help. And then they'll dispatch me there and I'll talk to the individual. So as you can see on the next slide, like I said, just talking about specifically in substance use, not everybody's eligible for detox and not everybody's even eligible for rehab based off of that detox. And that's not for me to 100% decide, but I help the individual navigate that. So we'll call detox centers together. If they're appropriate, then I will provide the transportation if necessary to any freestanding detox facility across the state, including one of my favorite ones down in Bridgeport at First Step. I've worked with Recovery Network of programs multiple times. It's a great organization, and they've really been accepting of working with me. So, and then I guess one key difference too is that just when they get to that first location, that doesn't mean that we stop working with them. And I think Jennifer knows as well, as once they're actually even at detox, calling and following up with those counselors and providing any assistance that I can, and helping them transition from detox to rehab, from rehab to any sort of sober living or outpatient services. The same could be said for mental health services as well, right? Whether that individual's eligible for inpatient or outpatient treatment, and helping them navigate that, or any sort of immediate housing that they may need. And then for those who are not familiar with the 211 process for homelessness, that's another route I'll take if someone's struggling with homelessness, calling 211, working with the coordinated access network, finding appropriate resources when it comes to rapid exit, diversionary funding, rapid rehousing, or even getting on the by name list and pursuing a permanent voucher. So not only do I do those three things, but as you can see too, trying to really build wraparound services for the individual. So on the next slide, you can see that besides these three main categories, I'm also ensuring that they get the appropriate medical care that they need. I think that's something that people tend to forget, that primary care can be such a great resource for them and support network for them if you find the right provider, as well as any sort of higher education that they may need. Finding people meaningful employment, allowing them the opportunity to move forward with their lives rather than just, hey, here's a card and good luck. And then, we're really lucky here in the town of New Milford. We have, a wonderful organization that's a town-run department, and it's New Milford Social Services. And they're also assisting people with, getting on SNAP, energy assistance programs. I'll sit there, and if someone doesn't have medical insurance, I'll help them fill out the application, and we'll do it together. Whatever we can do to really help people move forward. So as you can see on that next slide, I work with a lot of different agencies, and Recovery Network programs is on there, as well as plenty of other ones that are within the town of Milford and within the greater area as well, because I don't do it alone. It's really, I'm kind of a brat. I just make a lot of phone calls, and then people pick up the phone and they say, hey, can I help? And by working together, we've really made a significant impact in our community. So on the next slide is kind of the best picture I can give for you. And it's, you have all these different silos, right? All these different organizations doing all this incredible work. And then I'm just kind of that bar across the top, and I'm just navigating from place to place, ensuring that we build whatever resources are appropriate for the individual and family, that they are given the access to that. So as you can see, over the course of the last year and a half now, we've definitely seen some positive results. We've been able to house, 29 out of 34 people that were struggling with immediate risk and or chronically homeless. When we, were first starting out, we had a growing tent city population, and people didn't know where to go for resources because unfortunately New Milford isn't a very large city. We don't have a lot of internal resources. Like I said in the beginning, we outsource a lot with Danbury. So I work frequently with, local mental health authorities like Western County Mental Health Network in Danbury, Apex Community Care, who've been doing great work for a long time, and I kind of navigate with them. And as you can see, even for financial resources and employment, connecting them to those agencies, but actually ensuring and following up to make sure that they got what they needed from those agencies, right? So whether they were food insecure or whether they needed assistance with employment, and it was more than what I could just do about looking up on Deed and doing some applications like, TBICO, what they do down in Danbury, and then following up and saying, hey, guess what? You've been able to move forward with that employment. And as you can see on the next slide too, it's more than just following up and saying, hey, like, here's a referral. It's trying to ensure that they get connected. So, when I say that I've referred someone to it, that means that we've sat there and we've actually made the appointment together. And then connected is I'll ensure that the individual made the appointment and establish that relationship with that provider. And if necessary, once again, providing that transportation, because in New Milford, we have a difficult time with transportation because there isn't much access to public transit. So, whether it's medical care, mental health, as you can see, it's just ensuring that, there is a huge stigma around mental health. And I think that we could all benefit from talking to someone every now and then. I think we all do that anyway. We talk to the people that we trust. And as I tell a lot of my clients, look, I go to a professional to do my taxes because I have no idea how to do my taxes. I don't know what's going on in this brain. Guess what? There are professionals out there that can help me move forward. So let's talk to them and let's get it going. So, and then lastly, on the next slide too, you can see what we've been able to do with substance abuse treatment as well, right? Ensuring that people complete detox, having, those conversations around moving forward, helping them transition to, residential rehabs, which I think a lot of us in that space understand how difficult that can be because of the shortage of beds. And then if there is a long wait for those residential rehabs, where do they go in that intermediate waiting time, right? So working with agencies like Continuum of Care or, MCCA's Sobering Center to ensure that they have a safe place to stay until they can make that next step. And then outpatient resources as well, right? Making sure that they can, when they get out of that residential rehab, how do we help them move forward and create a better life for themselves? So on the next slide, I got a couple different stories of how we've really grown in New Milford since the beginning, because that first one up in the left top corner is just really a picture of a tent city, which we had in New Milford. At one point, there were roughly about 30 people there. And I was just astounded by the amount of, dedication that they had to their craft. I mean, they found a toilet and they built an outhouse. They had a whole kitchen set up. I mean, they were creating a community there. And it was really trying to change that conversation with them to say that, hey, you have the right and the opportunity to be able to live independently as well. Let's not make this permanent. Let's make this temporary and work towards, what you really want to be, which is your own place. So, luckily, once again, working with, great leadership here in the town of Milford, all the departments came together and we formulated a plan to be able to shut down that tent city. And we worked with, once again, Catholic Charities and the CAN Network down in Danbury, and we provided resources and we housed everybody that was living in that tent city. And there are no longer any tents and there are no longer any people back in that area like there was a couple of years ago. And then I guess for a lot of those that work in policing too, that calls sometimes can just be random. I don't watch The Simpsons. But obviously for those that do, that clown right in the bottom left there, we got a call just saying, hey, there's this lady pushing this clown life-size 6 feet in a shopping cart on the green. And I went and talked to her, found out that, she just kind of got up here, didn't know where to go. We were able to find a local shelter for her here in the town of New Milford. And it was her buddy, that's what she named him. And she would make the bed for him next to her every night in the shelter. So realizing that, there was some severe mental illness there, I was able to work with, local mental health authorities and, get appropriate resources. And we ended up housing her, and she's still housed this day, almost 2 years later, And it was a really great success story because it came from just a random call to, hey, let's follow and connect the dots here and work together, which we did. Which then really kind of brings me to that last photo on the right. We started giving more presentations to the community in the prevention space, saying, hey, if you see something, you can call and we'll help. And I gave a presentation to the Rotary Club here in the town of Milford. And no lie, the next week, one of the members of the Rotary Club saw this individual sitting next to the town hall, and it was freezing outside, and they thought that he was homeless and needed help. And so I drove right down there, talked to the individual. It sounded, he had recently relapsed and couldn't find any resources to get into treatment, and he wanted to get back on his feet as quickly as possible because he had been living in sober living and was enjoying recovery. So I was actually able to make a phone call right away. We found him a bed and detox, and I drove him within the hour, and he's back in his sober living now, back working. And it was really because we were able to work together. So it was it's been really great. So as you can see on that next slide, it's, really looking towards the future is really just getting back to what we were doing before in the first place, right? It's just having those conversations and learning how to talk to people. And then figuring out a plan together. So that's all I have. I know it's pretty quick. I appreciate everyone's time. It's been really lucky here. I think once again, if it wasn't for having such a progressive police chief and a progressive mayor who just said that, we need to work together and we need to figure out what we can do for our most vulnerable, we wouldn't be here today. And we've really seen major success because of it. So thank you all.
Thank you, Justin. Do make sure if anybody has questions, feel free to put that in the chat. We'll go ahead and let our next group start speaking, and then we'll circle back. So I think next, Captain Hohn.
Hi, can everybody hear me?
Yes.
Hi, Captain Hohn, Stamford Police Department. Justin, thanks that you gave a good explanation of the overview of mental health. I was probably 25 years in the job. I was put in charge of the behavioral health response this year or last year to try to come up with some new programs and opportunities for mental health clients, the people we interact with on a daily basis. Justin's demographic is a little bit different than ours down here in Stamford. So I'll just give you a quick overview. Stamford's a city between pretty much New York City, the Bronx, and Bridgeport. So we do have a large transient population, especially now migrating to the train station area. So what we're seeing now is a large amount of people want to be homeless by will, and a good portion of them are either drug related or have mental health issues. So we're dealing with that. Then we deal with our regular callers who are not treated or not being followed up on a regular basis. And then we have drugs, illicit drugs intertwined with mental health. So, the first thing is, I think the stigma of police being involved with the mental health issue is a little bit overblown. I think we help mental health clients more than we hurt them. In Stamford, we have probably 70% of our officers CIT trained. And as Justin said, just to try to have that conversation and connect them the resources we can. But as we go forward, in the last 3 years, we've noticed that the emotionally disturbed problem is really exacerbated. I mean, it's gone through the roof, and probably for several reasons. Now COVID doesn't help as well. So like I said, I was put in charge of doing a new response. I've looked at many models, from the Arizona model, Scottsdale, Colorado, and a lot of them are costly and maybe not effective to Stamford and Fairfield County, because out west, they have large amounts of counties with 5 million people in the county. Here in Fairfield County, we're segregated from city to city, town to town. So we got to see what works best for Stamford. So we've been studying the issue. I am a liaison between Stamford Hospital and I work up at the ER pretty much at least 2-3 nights a week. And I hire officers on top of it. And a lot of our problem is we're having 4, 5, 6 emotionally disturbed people come in at night. Some are violent, some are compliant. The problem is it's a revolving door, right? So as long as the hospital makes people clinically sane, they get shipped back out to the public, and we're getting calls. So we're getting 2, 3, 4 calls a day, and sometimes the same client 3, 4, 5 calls a week. We bring up the hospital leave. So we're looking for a balance here. You know, talking to the hospital and with the problems we see up there, the whole mental health issue is really borderline on a crisis. And like we called COVID a crisis, mental health is becoming a crisis, and it's taking resources away from the police. It's bothering the community as far as people seeing things that are unsightly. It's people not getting treated, people not taking their medication, or no resources at all because they're afraid to come forward. And there's so many different avenues of mental illness between schizophrenia, depression, illicit drugs, just temporary mental illness because you're going through a hard time. And in Stamford here, we also have a large migrant population, 35,000 Hispanics in Stamford. And we see a large amount of mental illness within the Hispanic population as well. So that's another angle that we're trying to combat, because you have two problems now. You have a language barrier, a cultural barrier, and now a mental illness. So what do we do with that? So we're trying to work on that as well. So we pretty much looked at this from a lot of different angles, and the chief and we came up together and to make a collaboration with someone. So we went outside and we hooked up with recovery networks to try to establish a social worker to be embedded with the PD to start combating these problems. We want to lower our call volume down. We want to try to limit our police exposure to a lot of these calls. We want to have what I see is the black hole. As soon as they get released from the hospital or they're institutionalized for 30 days because they're a danger to themselves or the community, there's no follow-up. And within 3 weeks or even less, they didn't go to their doctor's appointment, they're not taking their medication, and they're back into our system, and the police got to be called again. So that's what we're seeing our major problem is. So when we teamed up with recovery networks, our goal is to reduce these calls and get resources and have a social worker help us, the police department and our officers on the street, to tie these people in, or I'll say clients, to resources and to follow up. And I'm not saying it's gonna be a perfect program, it's really trial, but we see a lot of promise. I see if we could just connect people with resources after they get released from the hospital or after the social worker has an interaction with them, I really think it's gonna start lowering the calls. Then they have a contact. And in Stamford, we have a lot of different players in all different avenues, but no one's really together. So, you know, and then you throw in, you know, drug addiction, and I'll talk about that in a second, but it's a lot of different things, 20 different players between the shelter, the hospital, and everyone else in between. But we at the PD don't have one person we can say, hey, listen, could you help us out on that? And that's what we're looking for recovery networks to do. So it really, in closing with the recovery networks program, we're looking at as be a resource for the officer to respond to scenes if they have a familiarity with the client. We're not going to send them at this point to every call, but we're going to hopefully start growing into that kind of program. And, you know, I visited Waterbury, I visited Hartford, and I see a huge amount of calls up there as well, but they have a lot of state resources. They have state social workers that respond to the scenes to these calls. We don't have that resource here in Stamford, and we need it. And they're not going to give us the funding for it right now. Hopefully more funding to start going forward, but we're drowning down here. And I don't know if it's because we're lower Fairfield County or, but we have Du Bois Center. We have a lot of mostly served housing areas, but we don't have any social workers that we could really count on a call to come to calls with crisis. So we're hoping this social worker who looks like might be bilingual, if we hire, everything goes forward, will help us immensely. And that's what we're looking at. So, and then the last thing, just about the overdoses, and you know, we've seen obviously in the last few years a huge amount of overdoses due to fentanyl, drug, and everything else. So what we've been doing also from the PD perspective is trying to send our narcotics unit over to the scene or the hospital to try to get interview in a good way, not in a bad way, not punitive, and help the people who are struggling, to try to get them the resources. So we're also going to try to use that angle as far as getting people help, addiction problems, because it does go hand in hand, depression, drug abuse. But that's another thing we've been doing, what we've never done before. We try to investigate in a good way and not in a punitive way. And then we've also been having conversations with the court, and I just had some 2 weeks ago about diversionary programs. You know, unfortunately, a lot of people who are emotionally disturbed, they commit low-level crimes, some high-level crimes. And we've had some unfortunate instances in the last 3 months, no other choice but to arrest. And we had, warrants, but we collaborated with the courts. But there was a little disconnect with the courts as far as getting mental health evaluations after the arrest as well. So that's another program we want to start working on as far as collaborating with the courts, because we do want to mitigate their exposure to the court, the correction system if we can. If mental illness is the issue and they get treated or taking their meds and we brought them back into the community, which what we're hoping to do, is that their crimes are mitigated because it was due to mental illness. So on a whole, that's really what we're doing here. Like I said, this is a trial thing. You look at the programs out west, they're immense, they're millions of dollars. Stamford Hospital and probably most police departments in the city are all, the clearing centers of the hospital. So it's catch and release, unless they're really like the tier 1 problematic where they're a danger to themselves or the community where they'll take them. At that point, we're fully loaded at our Stamford Hospital. We have 17, 18 beds in our, we call South 1, and it's full. And you go to Whiting, it's full. I mean, everything is filled up right now. And the resources to house these people are not there. So therefore, it gets kicked back to the PD, kicked back to the community. And we're doing the best we can, like I said, but we really do think this is a step in the right direction with recovery networks. And, the other thing is data collection. So, a big thing, Justin, especially you, in New Milford, data collection is like the biggest thing. Like when officers respond to crimes, instead of saying it was just a disagreement, but there might be some emotion disturbed undertones to it, we need to know that. Because what we've been noticing is that a lot of these calls we get underreported, but the main issue is mental health. And now if we could start saying, okay, they're having domestics, but it's because of mental health issues, then we send our social worker from our RMP out there to try to mitigate these calls and lower it so we don't go there anymore. So that's another approach we're going to be doing, is a lot of data collection, changing our coding systems. We're sending EMS to a lot more calls now that are low level. Here in Stamford, if you threaten suicide, you could just be having a bad day, you're depressed. They don't need the police to go. We go there as almost as to make sure the scene is safe if they need us. And we're trying to back away from the really non-dangerous calls and let EMS go. So that's going to lower our call level as well. So it's really a 3-pronged approach here, but our first step is with RMP and getting this program, this collaborative, off the ground. That's really all I got, unless you want me to touch on anything else, Jen and Fram.
No, I think that's good.
If you guys want to come in, from there.
Yep. Okay. So good morning, everyone. Thank you so much for your time. Captain, thank you for the great overview. And Justin, thank you also, because your program sounds very impactful also. So we are thrilled to be here to be sharing with you a very new initiative that actually Frambiel Rodriguez, a former RNC employee and retired police officer, approached me probably about 2 years ago now, because he spoke so highly of the Stamford PD leadership team and how progressive they are in terms of solving some of the community problems that they are facing. So we're so grateful to all the Stamford PD for entertaining the idea, really creating the idea, and then inviting us in to be a part of it. So I'm going to provide a brief overview of Recovery Network of Programs. We are a behavioral health care organization that's been serving Fairfield County for 49 years. We're on the precipice of celebrating our 50th year of serving our communities. Our mission is to restore hope, health, and well-being for individuals and families in a recovery environment that embraces dignity and respect. And we're also on the cusp of rebranding and have a new logo. And I wish I could share it, but we are just going to do a press release first. So I was told just hold off on that. But it's very, very cool, but in alignment with all the work and the impact our organization has. So in terms of our history, again, we have been serving the greater Bridgeport area for 49 years. The majority of our programs are in Bridgeport. We have one large medication-assisted treatment program in Stratford. And with the addition of 2 federal programs, we have increased sort of the geographic footprint of our impact, not necessarily with bricks and mortar programs, but in terms of our outreach in various communities and getting individuals into care. So one of the very, very unique things about RNP is that we have 24 distinct programs. So we have a full, extensive continuum of care for individuals that we engage into treatment. One of the pieces that Captain Hohn spoke of in terms of working with us at RNP is that, one, we intend to leverage all the services that we have within our care because we prioritize the individuals who we engage. But we also have the intention of leveraging the services that are in the Stamford area. So we're not intending to reinvent the wheel. There's great services that are down there that we will leverage that are there for their community. But that our social worker will have somebody dedicated solely to making sure we close that loop that Captain Hohn spoke of, that individuals find themselves somehow caught up in the system and then unfortunately get brief intervention treatments that and then they don't stay engaged, and then the issue or the individual recidivates in terms of the issue. So that's one of the things I just want to clarify as well. So RNP has, as I mentioned, 24 different distinct programs. We are out, I think I'm a little bit out of line. This is our newest program, I'll go with this, is a new SAMHSA funded program called the Community Center for Integrated Health, which is located in Bridgeport. We have 18 staff that are working directly out of this program, as well as 3 partner agencies. And the whole the basis of this program is to provide holistic, integrated care in one location. So in other words, as many of you are very familiar with, is to make it as easy as possible for individuals to receive the treatment and care that they need. So we have primary health care on site, we have psychiatric services on site, med management. A very large component of our CCIH program is outreach and mobile services in the Fairfield County area. And then we provide substance use treatment, co-occurring treatment within our agency. And if an individual requires long-term treatment, again, we leverage other services that are within the state. Throughout CCIH and throughout RNP in general, we have a very extensive peer recovery support network of individuals who have a shared experience of either mental health, incarceration, substance use disorders that are in recovery, and working directly with our individuals, which really is an incredible resource to our clinical teams and our medical and our nursing teams and our care management teams. Next. Our residential programs, it's a very extensive continuum here as well. So we have emergency, transitional, and permanent housing within the Bridgeport area and scatter site housing. We also have 2 residential treatment facilities, 30-day voluntary. One is New Prospects, which is duly licensed for mental health and substance use disorders, as well as Horizons, which is also actually duly licensed at this point, but also serving individuals who have both mental health and substance use disorders. And then we have a very extensive community outreach and care management program in the Bridgeport area for individuals who have mental health disorders. The individual has their own lease, but we provide extensive care management to the residents and provide services on site as well. And then we also have First Step Detox that Justin mentioned, and it is a medically monitored detox over by Bridgeport Hospital. We have 27 beds there for individuals who require alcohol, opiate, or benzodiazepine detox protocols. From there, our detox then does always provide the next level of care for individuals in their recovery. Next. Okay, we might have skipped over just briefly, so I just want to talk briefly about our outpatient services, because we do have extensive traditional outpatient services. at 3 different locations. All of the locations also have primary care on site at this point. And that way, again, that allows choice for individuals and also geographic areas that are more amenable for some based on where they're living. But again, all have mental health and substance use disorder services that are available on site. And then we have 2 relatively large medication-assisted treatment programs within our outpatient services. One is, again, located in Stratford, and the other is located in Bridgeport. So with that, I will turn it over to Frambiel Rodriguez to talk about this new partnership in detail.
Hi, everyone. I guess it's my turn. I'm very happy to be here and very excited for this new program. So we're kind of go over to the next slide. This is just letting you know that that first slide that we just went over is one of my favorites. It's how it all started. Stamford Police Department and RMP working collaboratively to establish the CRI. Thanks for going back. You can move forward now. All right. So just a little background about myself. I was a Stamford police officer for 16 years, retired back in October, and came to work at RMP. Right before that, I was a case manager for probably about 5-6 years at RMP, one of the RMP sites, Prospect House. Worked under then Director Jennifer Kolakowski, who is now the CEO here at RMP. So about 2 years ago, and you know, I'm by no means a genius or anything like that. I wasn't trying to reinvent the wheel. I was working at the police department and was encountering many calls that involved people who had mental health issues. And that number kept growing as the years kept passing by, as Captain Hohn stated earlier. So I went and, like probably many people who aren't here, or probably everybody else here, I was on my fire stick one night and I was looking for a show to watch. And I came across a show called Ernie and Joe Crisis Cops. I watched that show and it blew my mind what the San Antonio Police Department was doing. The San Antonio Police Department established a mental health unit probably about 16-17 years ago. And at that time, it was very innovative. It was social workers and police working together within the same unit. And I was like, oh my God, that's a genius idea. I went to Captain Hohn one night and I said, hey, Cap, what do you think? He was like, Fram, it's a great idea. Do the research, let's make it happen. So I went back, did a lot of research. And part of it was that we in Stamford at that time, it was probably about 1.5 to 2 years ago, we're averaging 1.5 mental health calls a day. Now, for those who are in law enforcement, I don't know how many of you guys on this forum are, know that that number is probably under reported, because oftentimes what happens is that you go to a mental health call and that person kicks a hole in the wall and you end up arresting them, right? Criminal mischief. Got to go to jail. So bring them to jail. So now that gets recorded as an arrest, not a mental health call anymore. So we're probably looking at a higher number than 1.5 on average a day. That was just in Stamford. I didn't put any of those stats here. I didn't want to bog you guys down with stats, but as I kept looking closer and closer, I came to probably what shocked me the most. And I came to realize that the FBI was not keeping any stats until recently, probably about 2 years ago, 2.5 years ago, they started keeping stats on fatal police involved shootings. And when I started breaking those numbers down, which the Washington Post does very well, they're the only agency that was keeping these stats. The Washington Post, and I just ran them again yesterday, particular for this forum. They've been keeping them for 5 years. So as of yesterday, there have been 6,214 police-involved shootings. Out of those, 1,431 had diagnosed mental illness. That's 25%. 25% of the people getting shot and killed by cops have a diagnosed mental illness. Now, if you take that into account, that probably about 50% go undiagnosed, that number is probably a lot higher, right? So I'm gonna say you're probably looking about 50%, anywhere between 50, 60, 70% of the people who are getting shot and killed by cops probably have a mental illness. That stat there blew my mind. If you take into account the repercussions across the board of what this does to the officer, to the person who was killed, to the officer's family, the family of the person who was shot and killed by the police officer, is mind-blowing. So just keep that in the back of your mind. We could move to the next slide. So we all know this is touching on substance abuse or substance use disorder, I should say, and mental health. We all know we've been in the business for a very long time and out of experience, and we all know that goes hand in hand without a doubt, 100%. So out of most of our encounters in law enforcement will be with somebody who has some kind of crisis, whether it's mental health or substance abuse, they're in crisis mode. And down at the bottom, it's just a couple of, more stats. 8.9 million Americans are living with, co-occurring disorder, which means they have both. For those who don't know what that means, and fewer than 5.5% are enrolled in some kind of treatment. So we can move over to the next one. So I know our focus here is in 100% it should be is mental health and substance abuse. But I came from a social work background, right? And although I chased a lot of bad guys, took guns off the street, made drug arrests, and had a lot of fun when I first started, what bothered me the most was going to calls and not being able to help people because I didn't have the resources. So I got a million examples to give. I'll give you one, and I've used it probably in every presentation that I've done. In the area that I used to ride, there was an elderly lady who was probably about 83, 85 years old, had no family. Husband had died a year prior, and she would set off her alarm once a week, at least once a week. So I would show up, and all she wanted to do was talk. She had nobody to buy her groceries, nobody to take care of her. She didn't have a home health aide to come, clean the house and make sure she was okay. And I would always say, you know what? I'm going to try to get her some services, but I would leave there and I would get a car accident or a robbery or assault. And then because I was busy, I just couldn't provide her the services. So I felt helpless at that point for her. And that's just one example. There's, you could run, a million different examples that police run into like that we just don't have the resources to help. That's not our thing. So having somebody embedded in a police department could help or could have helped or could have been a resource for me to say, hey, listen, I know I can't do anything for you right now, but I have Jennifer Kolakowski, who's the social worker that works within the police department. And I'm going to write a small report and send her down, and guess what? She's going to call you in the morning and she's going to make sure you're hooked up with some services and make sure you're okay. Maybe you need somebody to drive you and get some groceries because you can't, because you're 85 years old and you just can't manage that. But this slide particularly touches on everything that we are going to be able to provide for the police department with a social worker who is embedded there full time. And you guys, I don't want to bog you down with all this stuff, but substance abuse, mental health, counseling service, medication assisted services, suicide prevention services, community management, job training, you name it, we could do it. And there's an atmosphere right now that police officers are insensitive. And if you want to start solving some of those issues with the community, this is the way to do it. You have a police officer who comes to the scene and tell somebody, you know what, I really can't help you, and leaves, we're not going to be able to change people, and we're not going to be able to change people's minds or perspectives on policing. We have to be progressive, and this is the start. We could go on to the next slide. This particular slide just goes into what we're going to be providing. I want to say we're very excited. We did hire somebody for the Stamford position, bilingual, super qualified, smart. We're very happy to have her. She started actually yesterday. We're doing orientation with her, and she'll be heading up to the police department in a little while to get a little tour. So she is LCSW, has tons of experience with law enforcement, has a great background, and hopefully we'll be starting May 1st full-time at the police department. So that's part of what we're providing. RP is going to offer all the other services that you guys see on here: mental health treatment, substance abuse treatment, co-occurring disorder emergency shelter. Like Jen touched on earlier, we have such a vast infrastructure here that if we can't provide a service, we're obviously going to leverage what we need to in Stamford and use those community providers there. But for the services that we have here, they are encompassing, and we don't foresee a problem with that. So we could go on to the next slide. I want to touch upon the fact that once we start this program and get everything up and running and going, you're going to see that policing is going to be able to get, at least in Stamford, is going to be able to get back to doing police work, right? So police work, such as community policing, start engaging back with the community, more crime suppression if that's the need. Once these calls start being lowered because of the social worker doing her work. So this is going to touch on the evidence-based practice and initiatives that we have and that we're looking to do with the social worker that's going to be working out of the police department. Obviously, again, co-occurring, because we know that goes hand in hand. Trauma and gender-informed care, immediate same-day access. We're poised that if we don't respond in real time, we will be responding there within 24 hours of the incident to assist with the client. We also have recovery coaching and peer mentoring, motivational interviewing. We're going to be doing disorder and gambling integration programs, and smoking cessation. You can go on to the next slide. So this is just going to go into what we're still going to be doing up there. We're trying to enhance the system and providing a cost-effective way. I ran some numbers and doing all the research, and on average, the hospital spends about $2,200 per mental health patient that they see. And oftentimes they go in, they'll go in during the day, because I've dropped them off there. They'll go in and they'll come right back out, and then we're back dealing with them in the same day and in the same shift oftentimes. So this number is astonishing. I think back in 2017, it cost about $14.6 billion. And that was just for mental health care in hospitals, $14.6 billion. That's 19% of all emergency room visits were mental health. So we're going to be working with the police department to provide some diversionary programming as well. So if we have a mental health patient who obviously, has a very minor offense, and we're looking to get them into treatment rather than incarcerate them, because we know that doesn't solve the problem, as Captain Hohn stated earlier. We also, here, Captain Hohn touched about the court system. Here in Bridgeport, we have a program called the TPP. It's treatment pathway programs where it's pre-arraignment jail to diversion. So it's run out of the bail commissioner's office, and we are very successful in that program as well. Can you go on to the next slide? So recruit and hire full-time social, we're happy to say that we did that already. We're very happy, and she's ready and very eager to be involved. We're conducting a cost-benefit analysis to determine cost savings and treatment, arrest, or other high-cost services. That goes back to the hospitals and the amount of money that we spend in incarceration rather than treatment. And we're going to obviously keep stats and track the outcomes and the benchmarking to help inform all the stakeholders and funding sources. You could go on to the next one. And that's us. That's Jen and I. You guys have any questions? I also want to touch before I forget. I hope the Chief Shaw is in attendance today. I want to say thank you very much. If it wasn't for him and the Director of Public Safety in Stamford and the City of Stamford, the Public Safety Director, Ted Jankowski, and Captain Hohn, who are all very progressive and progressive in policing and want to make change and want to do the right thing and want to get people into treatment rather than having them incarcerated when we can. It's really showing how progressive Stamford is in this aspect.
All right, thank you so much. We do have a couple of questions, and I have a question in the chat box. My question actually is for Justin. You mentioned how you didn't have a prescriber in your area. And so I was just wondering, when you were making your connections with Danbury and your other communities, where did you start? Did you start in the hospitals? Did you start with the police departments? How did you kind of navigate figuring out how to get those services for New Milford?
So you mean where did I go to find the prescriber, or just resources in general?
Yeah, where did you go to get that particular support for your community?
Well, I mean, the great thing about New Milford, I'd say, is since it is so close to Danbury and it is in Litchfield County, so even though we're through G18, through the Torrington Court, there are already agencies doing work in the community, right? Apex Community Care, MCCA, Greenwood's Counseling Referrals, McCall Center for Behavioral Health. There are agencies who have this is part of their catchment area, and fostering those relationships with those agencies to alleviate, because I'm not that professional, right? It's just hey, look, can you follow up with this person? Sure, they get connected, and then I'm on to the next one, right? Because it's more acute based for me. But that groundwork was already laid for me.
Gotcha. Great, thanks. We did have somebody ask, will one social worker be enough? Though, it's obviously a great start. Do you have plans around your social worker? Go ahead.
I can do that. We do anticipate expanding and enhancing it. We know one will not be sufficient to meet the needs, but it is a start. And we're in the process right now of submitting a number of different proposals, because there's been so much interest among various police departments. So to answer your question, no, we know that one is not sufficient, but it's a great start. And our intention and our strategic planning and thinking around this is to expand and enhance the program significantly.
There was also a question around whether or not emergency room staff and hospital discharge planners are going to be educated in the police programs in Stamford, and also possibly meeting with your new social worker.
Jen, I can answer that.
Yep.
Yeah, I've already laid the groundwork. No doubt the hospital is on board. They're already been briefed and are excited as well. The thing is, we got to get this ball rolling and get everyone on the same page. There's so many players in this, but obviously the hospital's our first stop, and Caroline will be starting this week, and she'll be at the hospital probably by Friday, at least meeting the key players there. And like I said, recovery, and I think whoever just asked that question just nailed it, is when they get released from the hospital or they get released from South One. And I noticed this, the last 3 that I monitored, they don't go to their doctor's appointment, but their doctor's appointments are 2 weeks away from when they got released. So they give them enough medication for 2 weeks. They say, go see your doctor at Optimus in 2 weeks. And guess what? No one's on the aftercare. And that's what we're hoping our social workers are going to be able to do to try to bridge that gap. Because 2 weeks is a long time for someone that's really not able to care for themselves. And we've really been seeing that, and it's a huge problem. So we're hoping that we're going to be able to get on the same page. And we also got to remember, and here's a problem for everyone at this table, is HIPAA. You know, HIPAA is a benefit, but it's also a detriment, you know, because we can't interact and talk to people on a group basis unless they sign a release form. And, you know, sometimes they're not able to sign a release form because they're not capable. And the hospitals are very reluctant to release information because of HIPAA. So it puts us as a police department and also as a collaborative behind the 8 ball with the HIPAA issue. So we work around it the best we can. I think collaboration with the hospital, I have a great relationship with the head of security and them over there. We work around it the best we can, but it does put some hindrances to the issue.
Great, thanks. Trying to see what else. There is an idea around having, you know, certified peer recovery support specialists. I know CCAR is very involved in that. There are other organizations who help to do that with, you know, riding along with police on SUD and mental health crisis calls. I think that the more network around that is the better, absolutely. And I know sometimes some communities actually, so Justin, part of why I asked that question is I live more in the eastern part of the state where we, you know, it's mostly state troopers. And so, you know, who aren't necessarily part of a permanent police department in the small towns. And so sometimes that's the, you know, where to go to get the resources can be difficult depending on where you're at in the state. I'm trying to see if there are any other questions. Does anybody else have any questions? All right. I'm not seeing many other questions. I do have a couple of announcements. Do any of our speakers have anything else you want to add or discuss? Things that you thought of as you were listening?
The one thing I would like to say, I think, you know, having these conversations and really telling everyone what's going on out there is important. You know, I've got 70 people on this chat. I just think some people don't see the immense problem that we're dealing with at the PD level, at a local level. You know, I look at Hartford, they have 9 social workers and they do respond to some calls. Down here, we have nothing, you know, and like I said, our officers, we have a lot, they're CIT trained. We've come a long way progressively. Well, we're getting no help from anybody else. And if it wasn't for, you know, Chief Shaw and Kolakowski giving us this money to partner up, we'd be at square one. And, you know, the problem is it's not going to end until someone declares a health emergency, a mental health crisis with COVID and everything else. And we haven't even touched on COVID. I mean, as I think Justin was saying, you know, I go on the street a lot and I see a lot of long-term sobriety be disrupted by COVID. So that plays hand in hand with mental illness as well, because people could be, you know, taking their meds and being sufficient and everything else. But guess what? They just got laid off. COVID has shuttered them. They're antisocial now. They stopped taking their meds. And then we see a new crop of problems. And, you know, I'm reading a lot on suicides of COVID and everything else. I don't even think that we've really hit the pinnacle of the COVID problem yet. And we're dealing with the basic, you know, mental health issues. And like I said, I think it's going to get worse before it gets better, but at least we're trying to take a step in the right direction to slow it down here in Stamford. I just hope the state sees it and everyone at this table sees how bad the problem is.
Deborah, this is Greg from Beacon. Regarding the medication assisted treatment providers, the Connecticut Behavioral Health Partnership on its website, ctbhp.com, does have a MAT locator map, which lists providers around the state. Like any database, it's only as good as the information people give us and how up to date it is, but we try to keep it current with current providers who are prescribing various types of medication assisted treatment. So that's another resource that people could look at, ctbhp.com, and then the MAT locator map. It's an interactive MAT, and providers can go right in directly and enter their agency and their services and handle it that way as well.
Greg, what is the URL again?
It's CT in Connecticut, CTB as in boy, H as in Henry, P as in Paul, CTBHP, that stands for Connecticut Behavioral Health Partnership. So again, for those who aren't familiar, the Connecticut Behavioral Health Partnership is comprised of the Department of Social Services, Department of Mental Health and Addiction Services, and Department of Children and Families. And Beacon is the administrative service organization for that partnership.
Okay, I'm going to try and put the map itself also into the chat. I see. That should take you to directly to the map that Greg just mentioned. Thank you. Thanks, Greg.
Welcome.
Let's see. We had a couple chats just around other programs, Troopy and Montville, working with Griswold Pride to have a social worker work with them. And then, yeah, Medicaid has some intensive care management that will assist people with acute needs or barriers to medical or behavioral health care. But yeah, the release of information can be tricky. I know in our last meeting back in January, the Litchfield County Opioid Task Force did share one of the forms that they are using. If you can go onto our website and get access to those resources, if anybody is interested and wasn't on the call the last time. I am going to share, I just as an FYI to everyone, this is National Volunteer Week. And here at the partnership, we've been involved with the Step Up Connecticut initiative in terms of encouraging new mentors. So if you have any interest in that, you can go to bit.ly mentor CT. We're always looking for mentors, especially those involved with, police departments and other, social services. Our young people, especially with COVID, have been, like Captain said, antisocial. They've been needing trusted adults to be able to talk to. We recently, unfortunately, had a mentee experience some very major trauma, and the first person that she reached out to was her mentor. So it can be very impactful. So if you want any more information, let me know, but otherwise you can check out the Mentor CT website. And at this point, our next meeting, we are planning on having it in July, exact date TBD. And we, it'll slightly different, but we are going to have Mark Jenkins, who's part of the Greater Hartford Harm Reduction Coalition, excuse my typo, be our speaker. And I know a lot of folks on this call have worked with Mark or know him from various interactions. So hopefully you'll be able to join us. It looks like Carol shared that tonight. There's a recovery advocacy project, has a statewide community listening session at 6:30. She put that information in the chat if anybody is interested. Are there any other announcements or anything else people would like to share? Greg, do you have anything else?
Yeah, one other point. Thanks, Deborah. And thanks for hosting this and for all the people who spoke today. Thank you very much. One other thing to keep in mind as we talk about resources for people, anyone in the state of Connecticut who has Husky insurance, that's Medicaid, and there's over 900,000 at this point that have that, so it's a large portion of the state. Anyone who has Medicaid is entitled at their request to get a peer support specialist through Beacon to help them with either mental health issues, substance use disorder issues, or family systems type issues if we're dealing with families and youth. And they do that simply calling the main number at Beacon, which is area code 877-552-8247, and asking for the peer support services department. And they can get some, so if there's an agency that wants to hook someone up and they don't have a recovery support person themselves, or their caseloads are full and they know the person's on Medicaid, that's another resource that's available.
Great, thank you.
I
yes.
just have a quick, I'm sorry, I just have a quick comment. My name is Stella and Todd. I'm the regional network manager for Region 1, Stamford, Norwalk, Bridgeport. So I just want to thank every contributor who's shared today. I really appreciate that. But I have a specific question for RNP and the Stamford Police Department to do with this new partnership using the social worker. So I'm interested in understanding or knowing how can CTBHP, specifically me as a regional network manager, help in supporting this new partnership or help to enhance it in any way. So I'd be curious as to, within this partnership, as you're working things out, where do you see us being able to be helpful, if anywhere?
Hi, Stella, I can start. I think right now, just helping us, I just put in the chat as well. I think one of the things is it's obviously new to us in terms of implementation, but 2 years in the making. So I think, we look forward to sharing data with everyone to demonstrate the efficacy and the efficiencies that are created by this program. So I think in that regard, that will be very helpful. And I think, to the extent just getting the word out in terms of, as I mentioned earlier, there has been Frambiel and Capt and I and many of us have presented to many police departments. There are so many police departments that would like to see this happen, but one of the struggles is always finding the funding around it. And Stamford PD was incredibly creative and proactive in how they were able to go about this. So I think just sharing what we're doing across the state, because again, our intention, and I'm sure Justin's as well, is to demonstrate the good work that is happening and how impactful it is, not only for the police department, but for our communities in general. So, and then stay tuned, because we'll let you know, where there's ways that, any pain points or obstacles or challenges we face, where we'll be reaching out to those that we collaborate with and all of our stakeholders.
Thank you. You mentioned the data. Are you able to share what specific data points that you are collecting data on?
We can, we're working right now internally, and then also with Stamford PD about what we think are some of the most key elements in terms of outcomes and benchmarks. So I certainly, we can share that and make that public within the next month. Right now, it's really more so in just, we haven't finalized it just yet, but pretty close. And as soon as we do, we're happy to share that.
Okay, thank you so much. I appreciate it.
Yeah.
Thank you. That's a great question. And Frambiel and Captain Hohn both shared contact information in the chat. If anybody has any resources to share or questions about the program. We also did, I'm sorry, I forgot, Saturday is the drug take back day. There is a list on the DEA website for anyone who is looking for a place. And Durham and Middlefield resident state troopers offices will have their take back locations. You can also, for Connecticut, you can always Google drug disposal near me, and Google has a special map with all of the police departments that have drug disposal boxes available. And there might be other special events and locations that you can check out through your local prevention councils or the RBHAOs. Real quick, I do always have the request, if you're willing to take a quick poll for us, especially the last question. There are 5 questions total. And I tried something new. Zoom has now enabled live, live closed captioning, live transcripting. It is done by the computer. It's not someone listening. So it's not perfect, but in an effort to make sure our presentations are accessible to all, I'm playing around with some of those options. So thank you for those who are taking the poll. I will leave that up. Yes, Greg.
I'm sorry, while people are doing that, just one other bit of information they might find helpful. I know we referenced the state police several times. Of you that are surrounded, and like most of us in Connecticut, it's not that far, for towns that do not have their own local police departments that are serviced by the state police instead. There's exciting work going on with the Litchfield County Opiate Task Force that has been training both the supervisor, new officers at the State Police Academy, and have been invited to train all the new state police recruits in the state. So if you're interested in making that connection, I would suggest the best person to contact would be Maria Kooten-Skinner, who's the CEO of McCall Foundation in Torrington. They're doing exciting work training the whole state police academy at every level on the kind of work we were talking about today. So if you have connections with a state, with a town that is covered by state police, that would be one way you could get connected to those people for finding out what's going on police-assisted addiction recovery work in that sector.
Great, thanks, Greg. Yeah, I remember them talking about that. All right, well, so it's a little bit before 11. I appreciate everyone for being with us today. Thank you again to our speakers very much for sharing your knowledge and information. And we do look forward to having you back to let us know how it all is going. I think that's one benefit of this group, is really sharing what's working, what's not, how you're navigating the different pathways to get things to go smoothly, but then also any data that you're able to connect. So I will reiterate this, I put it in the chat, but our PowerPoint presentation and the video will be shared with everyone. So you'll be able to have access to it later. All right, thank you so much. And I hope everyone has a great rest of your day. Enjoy the sun while it's here. And again, we'll be sending out information about our next quarterly meeting in July.
Great, thank you.
Bye.